So, is gum disease linked to Alzheimer's? Well, yes, it is. And not only that, but there has been not just an association detected, but a causative link. So there is the possibility that gum disease plays a key role in the development of Alzheimer's. Now, bearing in mind that 95% of the population have some form of gum disease, I think it's 95% from what I remember, then this is really, really important. And it means that having identified this key pathogen, this key bacteria linked with both gum disease and Alzheimer's, then this is a real focus for a potential cure or a limitation of the disease. Now, the bacteria that's been linked or has been associated with Alzheimer's, it's called P. gingivalis, Porphyromonas gingivalis to give it its Sunday name. And this is a real key bacteria. So it's found in kind of chronic irreversible gum disease. So where not only the soft tissues around the teeth are affected, but where there's starting to get bone loss around the teeth. So P. gingivalis, this key bacteria in gum disease, has been found in the brains of Alzheimer's, but not just that, it's been found to be associated with areas of inflammation in the brains of people with Alzheimer's, and also the toxic byproducts of this bacteria as well. Other research has shown that gum infections can actually worsen the symptoms of Alzheimer's. So how does this bacteria end up in the brain of people with Alzheimer's? Well, the gums have got a really high blood supply. They're very vascular. I mean, you know this, if they're slightly inflamed, they just bleed. So with the bacteria being present, it means that they can get into that bloodstream if the gums are inflamed, and they make their way through the bloodstream to the brain, and they can obviously cross over the blood-brain barrier. So this is going to be, I think, part of the key research into how it manages to get across the blood-brain barrier and into the brain, because the blood-brain barrier is there for a reason. It's there to keep toxins out of the brain and protect the brain at all costs. So how does this bacteria manage to get across? And I have a feeling this is going to be a key area for research in how to help prevent the gum disease having an association with Alzheimer's, and may help to prevent or delay Alzheimer's. Now, as to gum disease causing Alzheimer's, research has shown that by introducing the bacteria into the brain, it can actually cause these Alzheimer's linked areas of inflammation. So this all boils down to the fact that all health is linked, and I've mentioned this before. This is something that I truly, truly believe. All health is linked, and anything that is good for your mouth is good for your general health, and looking after your gums is key.